lifestyle at the grassroots levels. Then we created the Bharat Nutrition and Lifestyle Classroom. Our Prime Minister has a very simple vision. While we treat disease too late, how do we make health creation early? For that, we created the Bharat Nutrition and Lifestyle Classroom, and today we're going to talk about the amazing preventive cancer screening initiative. We had the Bharat dish that launched out. If you see this little QR code over here, right now if you take your phones out and you click this QR code, you will have access to every menu that's been ever made for the country, and you will have access to the Bharat Nutrition and Lifestyle Classroom, which you can play for yourselves as well as your children or your schools. On the 31st of May and 1st of June, the Bharat Nutrition and Lifestyle Classroom was a free session for children between 7 and 10. We had sessions over the whole country in English and Hindi. This has now moved into an expert-guided classroom where we have experts from across the country who have broken down the classroom into nutrition, movement, sleep medicine, emotional wellness, and the integration of yoga, pranayama, and movement. As we speak, children across the country have this played for them in schools and by their parents at home. Our Prime Minister's vision is that education should be digital and it should be able to reach any one of our citizens across the country. We broke this down into nutrition, into exercise, into sleep, into yoga, because for the longest time we believed that only nutrition can actually fix the health crisis. But today we understand that there's a lack of physical activity. One of the strongest pillars in lifestyle medicine is sleep. And that is something that all of us have to improve. It becomes now a clinical pillar in integrative and lifestyle medicine. And while the world is looking for complicated exercises, which we can do, we should not forget our tradition of yoga and pranayama. How our own system of scientific breath work becomes the #1 way to reduce stress levels and regulate your nervous system. The curriculum is built on balanced nutrition, exercise, sleep, emotional wellness, and yoga. We have schools across the country who have embraced this right now, and it continues to be embraced. Over the last couple of days, we had schools from across the world, Indonesia, Vietnam, and Australia, reaching out to understand how this program works so that they can run it in their own curriculums in school. Now we expand the vision, the Namo Shakti Rat Breast Cancer Screening Initiative, which our Honorable Prime Minister spoke about. This is an initiative, again, of Sri Kartikeya and Dr. Aishwarya, where healthy women and empowered families, we look at prevention as key. They picked up a Guinness Book of World Records for doing the most amount of screenings in 24 hours. 20 mobile screening vans ensuring timely screening and early detection. The ITV Foundation achieved the Guinness World Record for the most AI breast screening across states in India, and this will soon become a nationwide affair. Prevention is always better than cure, and that's why it is imperative that we focus on early symptoms and then the right treatment. In collaboration, we will now integrate nutrition, lifestyle habits, and daily routines amongst all of our people across the country to strengthen the model of healthcare. We have to move from a model of sick care to healthcare and prevention, and that is absolutely the vision. So the future of healthcare begins early. Right knowledge. How many of you get all of your knowledge from Instagram and social media? Put your hands up. It's okay, put your hands up. How many of you are confused? Keep your hands up if you are. It's the same amount of hands. We don't need confusion. We need right knowledge and we need action. If there's one thing that's missing today in our country, we have a lot of information, we have a lot of knowledge, we have a lot of content, we have platforms that bring amazing people like you together. But there's one thing that's missing that is forming a major dent in our healthcare system. That is the lack of action. While you continue to learn, while you continue to absorb more information, it's extremely important to put it into action, because we only get the results of great knowledge when we add action to it. So thank you everyone for listening. I would advise all of you to invest in prevention, Keep following the Bharat Nutrition Lifestyle. All of you over here, we can contribute in one way. When we unite as a country, all of us may not be doctors, nutritionists, and engineers, but we have a human heart and a human brain to share the right knowledge and share information amongst our communities and societies, so together we educate and together we enable people to move into action. Thank you so much.
Thank you so much, Luke, for that inspirational address, of course. And yes, as you said, you have translated a lot of your thoughts into action already. And that's what really NXT is about, isn't it? Like we mentioned in yesterday's chief guest's address. Okay, let's now move on very, very quickly. Staying with this segment of Next in Nutrition, we now will be having a panel, in fact, on Next in Nutrition. And in fact, to speak about the theme of the future of nutrition, we have a very, very holistic panel that we've drawn together for you. So I want to quickly call on stage now, one by one,